Alright, here's the rewritten script, sentence by sentence, in the voice of Dr. Anya Sharma. Hold on just a moment, please. Those everyday things you've been doing for years could be quietly harming something incredibly important to you. I'm Dr. Anya Sharma, and for over 30 years, I've been a dedicated urologist and men's health expert, helping men just like you achieve better circulation, stronger erections, and renewed self-assurance. You already know the basics: healthy eating, regular exercise, and avoiding smoking. But very few of us realize the hidden dangers that exist in our everyday routines. The well-intentioned but misguided tricks that can damage tissue, the overly firm grip that can dull sensation, the heat from steam rooms, laptops, and tight pockets that can negatively impact fertility and hormone levels, or the uncomfortable silence that allows warning signs to go unnoticed. In the next few minutes, I'm going to reveal 10 crucial things that every man over 60 should stop doing today, from overlooking morning erections and neglecting gentle hygiene to risking penile fracture during passionate encounters. And I'll offer doctor-approved, research-supported alternatives that can easily become part of your daily life. By the end of this video, you'll understand precisely how to protect your penile health, take care of your heart, and maintain intimacy without resorting to gimmicks or guesswork. And be sure to pay attention to the 10th thing not to do. It's so easily overlooked that most men don't realize it until the damage is irreversible. Please stay with me, because missing even one of these points could cost you more than you can imagine. Before we get started with these important tips, please subscribe and click the notification bell. Keeping informed is crucial for your penile and heart health. If you find this information helpful, please type a 1 in the comments. If you'd like to see improvements, type a 0 and let me know how I can better assist you. Now, let's get right to it. Our first essential don't. Never ignore what your penis is trying to tell you, because those early signs could be the first indications of a serious health problem. Number 1. Don't ignore your penis. As a doctor who has spent over 30 years hearing men's stories in my office, I can't emphasize enough how often I see these very common signs being dismissed. Weaker morning erections, hesitation before intimacy, or that nagging feeling that something just isn't quite right down there. Your penis is more than just a source of pleasure. It's your body's built-in warning system. When blood flow becomes restricted, hormones become imbalanced, or stress increases, your erections are often the first to be affected. I've seen otherwise healthy men dismiss these subtle changes until they're faced with unexpected heart tests, unplanned hospital visits, or difficult conversations about irreversible damage. Ignoring early warning signs is like driving a car with the engine light flashing. You wouldn't do that, would you? And yet, so many of us ignore the most important engine of all. A sudden decrease in firmness, a delayed response to stimulation, or a reduction in size can all indicate underlying cardiovascular problems, diabetes, or nerve damage. If we catch these problems early, we can often reverse them or, at the very least, manage them effectively. You owe it to yourself and to those who care about you to pay attention, to monitor what your body is telling you, and to take action as soon as you notice a change in your usual rhythm. Remember, catching these changes early doesn't just protect your sexual health, it could very well save your life. Stay tuned, because next, I'm going to reveal the second thing you shouldn't do, something that's causing more damage to penises than you can imagine, and it involves a homemade remedy you've probably never questioned. Number 2. Don't use dangerous do-it-yourself remedies. I still remember the first time I saw the result of a man's attempt to fix his erection problems at home. He came to my office, his face red with embarrassment, holding a worn-out pamphlet of so-called natural solutions that promised instant results. He'd spent months jelqing, manually stretching his penis with increasing force, only to end up with painful micro-tears and scar tissue that made it impossible for him to achieve a single morning erection. I've seen countless variations of this same story: apple cider vinegar soaks that burn sensitive skin, homemade constriction bands made from soda bottles or plumbing rings that become impossible to remove, and a never-ending stream of unregulated pills and creams with ingredients as mysterious as their side effects are devastating. What's even more disheartening is knowing that these men often pay a high price: surgery to repair tears, reversal of irreversible damage, or the crushing realization that their attempt at a quick fix has created problems far worse than the ones they started with. If you're over 60 and feeling desperate, please remember this: your body deserves respect, not risky experiments. Instead of risking permanent injury with unproven home remedies, trust devices and treatments that are approved by reputable medical organizations and recommended by a qualified urologist. You wouldn't attempt to rewire your home's electrical system without a professional, would you? So, why gamble with the most personal part of your body? Coming up next, I'll share another crucial don't that's hiding in plain sight, something most men overlook every morning. You won't believe how a simple daily habit could be quietly undermining your sexual health. Number 3. Don't neglect proper hygiene. More than one patient has leaned in and whispered to me that they simply don't think about cleaning down there. And every time, my heart sinks, because the consequences can be both painful and embarrassing. When you reach your 60s, your skin becomes thinner, healing slows down, and even a small buildup of smegma or moisture under the foreskin can lead to infections like balanitis or fungal overgrowth. I recall one man who came to see me after experiencing weeks of discomfort. He was mortified by the redness and swelling under his foreskin and ashamed that it had taken him so long to admit there was a problem. The truth is that proper hygiene isn't complicated. Gently retract the foreskin, rinse with warm water, pat it completely dry, and you're done. But I've also seen men damage delicate tissue by scrubbing with harsh soaps or scented washes, turning a routine cleaning into a source of irritation and tears. Your penis deserves the same gentle touch and respect you'd give any other part of your body. Choose a mild, fragrance-free cleanser when water alone isn't enough, and resist the urge to scrub aggressively. Take a moment each morning and evening. These 2 small actions can prevent painful inflammation, unpleasant odors, and, worst of all, the worry that you might be dealing with something more serious. Remember, when you take proper care of yourself, you're protecting more than just your skin. You're protecting your confidence, your comfort, and your peace of mind. Now that you know how to keep your penis clean and healthy, stay with me for the 4th don't, because I'm about to share a warning sign that nearly every man ignores, and missing it could turn a minor issue into a crisis. Number 4. Don't ignore pain or warning signs. I'll never forget the day Mr. Thompson slowly walked into my clinic, his face pale and drawn, finally admitting that he'd been seeing blood in his urine for weeks but was too embarrassed to tell anyone. He dismissed it as simply getting older, even as the discomfort grew. By the time he spoke with me, the bleeding had become more severe, and invasive tests were his only option. His fear of being judged cost him valuable time. Pain, lumps, ulcers, blood in the urine or semen, unexplained swelling. These aren't just minor inconveniences, they're urgent red flags your body is raising. I've sat with men who delayed seeking treatment until a small ulcer became an invasive cancer, and I've heard the regret in their voices when they realized how early intervention could have spared them from severe treatment. You deserve better than to suffer in silence. Talking to your doctor about intimate problems isn't easy, but it's far less distressing than discovering you've allowed a manageable condition to turn into something life-threatening. Write down exactly what you're feeling, where it hurts, when it started, and how intense it is. Remember, a compassionate specialist has heard it all before and will focus on healing, not judgment. Your health and peace of mind are worth the discomfort of that first appointment. Don't let shame or stubborn pride prevent you from getting the care you need. Stay alert to every subtle change in your body and take action immediately. Up next, we'll address the 5th crucial don't, and it's something you might think of as passion, but if you're not careful, it can quickly become your greatest risk. Number 5. Don't skip safe sex and stay in control. I can't tell you how many times I've seen regret written all over a man's face when he realizes that one reckless moment has caused him weeks of pain or months of treatment. Whether it's an unprotected encounter that leads to an unexpected infection or an overzealous movement that results in a penile fracture, these aren't just embarrassing stories, they're medical emergencies that can change your life forever. I once treated a gentleman in his early 60s who had pushed himself to the brink of septic shock after ignoring the painful swelling from a sexually transmitted infection. He told me later that he had felt invincible, like past generations of men in his family, until his fever spiked and he could barely stand. And then there was the weekend warrior who, in the heat of the moment, bent his erect penis against his pelvic bone, resulting in a sickening snap followed by hours of agony before he made it to the emergency room. The good news is that you can protect yourself with a few simple, disciplined choices. Always use a high-quality condom and plenty of water-based lubricant to minimize micro-tears. Communicate with your partner about pacing and pressure so you can both maintain pleasure and stay safe. And if you're trying something new, ease into it rather than going full speed ahead. Think of safe sex as an act of self-respect and mutual care, not as a barrier to intimacy. By taking control of your sexual health, you're preserving your confidence, your comfort, and your ability to experience joy. Next, we'll uncover the sixth critical don't, and you'll discover how everyday sources of heat could be secretly robbing you of fertility and testosterone without you even realizing it. Number 6. Don't turn up the heat on your testicles. Over 30 years of practice have taught me that most men never realize just how sensitive their testicles are to temperature. Yet, I've seen the damage firsthand. I remember Mr. Garcia, a retired mechanic who loved his daily soak in the hot tub and never connected it to his gradually declining testosterone levels and low energy. He thought a little steam was harmless until blood tests showed his hormone profile looked 20 years older than his body. And then there was the software engineer who spent hours with his laptop on his lap, oblivious to the constant warmth against his groin that was reducing his sperm count without warning. Your testicles are located outside your body for a very important reason. They need to stay cooler than your core temperature to function at their best. Exposing them to prolonged heat, whether from a steamy jacuzzi, tight underwear made of non-breathable fabric, laptops, or smartphones in your pockets, disrupts sperm production and can even affect your natural testosterone rhythm. Imagine trying to grow a garden in an oven. The seeds simply won't thrive. Your body's reproductive engine works in the same way. You might think these comforts are no big deal, but make no mistake, they quietly diminish your vitality and your ability to enjoy intimacy. The good news is that small changes, like limiting hot tub sessions, placing your laptop on a desk, choosing breathable fabrics, and keeping devices out of your front pockets, can make a world of difference. You owe it to your health and to your partner to protect your vitality at every opportunity. And next, we'll dive into the seventh don't, where I'll reveal a private habit that many men unknowingly take too far, and how it could be sabotaging your sensitivity and your sex life without you even realizing it. Number 7. Don't masturbate with a death grip. I've sat across from more men than I care to count who confessed that their most private moments of relief ended up creating the biggest barriers to real intimacy. One patient in his mid-60s told me that he had developed an almost vice-like technique, so strong and so habitual that nothing his partner could do compared. Over months, he found himself needing more pressure and faster motion just to reach climax. And when it came time to be with his wife, no amount of romance or foreplay could bridge that gap. The result was frustration, guilt, and a growing sense of failure that affected every part of his life. This death grip not only diminishes natural sensitivity, but it trains your nerve endings to expect an intensity that human contact simply cannot replicate. You end up chasing a fantasy of sensation that doesn't exist, and your confidence takes a major hit. Instead of celebrating your body's capabilities, you become trapped in a cycle of increasingly aggressive strokes that numb the very thing you're trying to enjoy. I've helped hundreds of men break this pattern by teaching them to use gentle pressure and to incorporate lubrication, just as they would in a loving encounter with a partner. It takes patience and a willingness to relearn how you respond to touch, but the payoff is enormous: regained sensation, renewed spontaneity, and restored confidence in bed. If you've fallen into this habit, please know that you're not alone and that change is possible. Stick with me. Next, we'll explore why smoking and certain lifestyle choices may be secretly strangling your erections and your health, and how you can take back control. Number 8. Don't smoke and take care of your body. I've lost count of the men who've told me they never imagined a cigarette could steal their mornings, but after decades of lighting up, they wake to weaker erections and lower stamina. One patient, a former Navy pilot in his 70s, admitted that he'd continued smoking because it kept his stress at bay, only to find himself unable to maintain firmness and facing a frightening bladder surgery when cancer was detected. Tobacco doesn't just blacken your lungs, it constricts the tiny vessels that supply blood to your penis, making even the simplest journey to full rigidity an uphill battle. Beyond cigarettes, I've seen how poor diet, excessive alcohol, and a sedentary routine quietly diminish your vascular health, hormonal balance, and energy levels. You might think a burger and beer after work won't matter, but when plaque builds up in your arteries, it shows first in the most sensitive tissues. The good news is that every healthy choice you make, quitting smoking, choosing colorful vegetables over processed snacks, limiting drinks, and committing to a daily walk, delivers immediate benefits. I've watched former smokers regain their morning erections within weeks, and men in their 60s who started resistance training report higher testosterone readings and renewed confidence. Your body is remarkably resilient if you give it the chance. Replacing old habits with small steps, like swapping one cigarette for a glass of water or trading 30 minutes of TV for a brisk stroll, can rebuild your circulation and strengthen your erections more effectively than any pill. It's not about perfection, it's about progress, one healthy decision at a time. Stick around. Next, we're tackling the 9th don't that strikes at the heart of performance anxiety, and understanding it might just be the breakthrough you've been waiting for. Number 9, don't beat yourself up. Over the years, I've sat with countless men who blame themselves harshly after a single faltering moment in the bedroom. I recall Mr. Lawson, a gentle grandfather, who confided in me that his mind raced with self-reproach the morning after he couldn't maintain an erection. He told me he felt like less of a man, like he'd somehow failed his partner and himself. That guilt and shame become a relentless soundtrack, tightening muscles, elevating stress hormones, and creating a feedback loop that makes every subsequent attempt even more fraught. Your body remembers every tense thought, every fearful anticipation, and responds by diverting blood flow away from your penis toward your vital organs, literally turning down the volume on your intimacy. I've worked with men who believed a single setback defined their entire sexual identity until they learned to reframe their experience with kindness and patience. Practicing self-compassion isn't a weak approach, it's a powerful medicine. When you catch yourself spiraling into self-criticism, pause and speak to yourself as you would to a dear friend. Acknowledge the frustration, but refuse to dwell there. Mindfulness exercises, breathing techniques, or even a brief walk can interrupt the cycle of negative thoughts. Opening up to your partner and sharing your worries often dissolves the tension and deepens your connection, turning fear into mutual support. Remember, fluctuations are normal at any age, and one moment doesn't predict your future. Treat yourself with respect, and you'll find your confidence and your erections follow suit. Stay with me, because next, I'm revealing the 10th critical don't, the surprising habit that, if ignored, can stealthily rob you of strength and size, something every man over 60 needs to know. Number 10. Don't let use it or lose it become reality. I've cared for men who, embarrassed by a period of low desire or diminished erections, quietly stopped all sexual activity, only to discover months later that their penile tissue had begun to lose elasticity and even shrink. Our bodies thrive on movement and regular blood flow, and nighttime erections serve as vital maintenance cycles, oxygenating and preserving those delicate tissues. When you skip those natural repair sessions, whether due to stress, hormonal shifts, or simply avoiding intimacy, you risk tiny areas of scar tissue forming, which can lead to permanent changes in length and girth. One patient in his late 60s told me he assumed occasional lapses were normal until his once proud morning firmness faded entirely. Together, we introduced a gentle regimen of vacuum therapy and low-dose medications to exercise his penis at home, and within weeks, he began regaining both confidence and tissue health. You don't have to wait for desire to return on its own. Schedule intimacy, explore non-penetrative touch, and discuss physician-guided therapies if nighttime erections disappear. Our sexual bodies, even past 60, are remarkably resilient when given attention and care. By respecting these 10 don'ts, you're safeguarding your vascular, hormonal, and psychological well-being, ensuring that your most personal relationship with your own body remains strong, vibrant, and lifelong.